Prevention of COVID-19, presented by Wendy McIntyre, will discuss some of the World Health Organization's recommended prevention methods to help protect yourself and your family from contracting COVID-19. Objectives for this presentation are understand how to best prevent COVID-19, discover ways to integrate prevention into daily life, and reduce exposure to self and others. COVID-19, also known as novel coronavirus, is a new strain of coronavirus not previously seen in humans. It is transmitted through droplets sprayed by affected individuals, contact with patient respiratory secretions, contaminated surfaces, and equipment. Respiratory droplets are created when an infected person coughs or sneezes. These droplets can land in the mouths or noses of people who are nearby or possibly be inhaled into the lungs. Prevention begins with you. Why prevent COVID-19? The virus spreads very easily and is sustainable between people. Studies suggest this virus is spreading more efficiently than the flu. You might have family or friends who are less likely to recover from COVID-19. Older adults and people who have severe underlying medical conditions like heart or lung disease or diabetes seem to be at higher risk for developing more serious complications. Hand hygiene is the best way to prevent the spread of germs. It is especially important to perform hand hygiene after direct contact with ill people or their environment. You can perform hand hygiene by completing a hand wash or a hand rub. Based formulations can be used if your hands are not visibly soiled. This is considered a hand rub and must be performed for 20 to 30 seconds. To perform a hand rub with alcohol-based formulations, you'll apply a palm full of product into a cupped hand and cover all hand surfaces. Then you're going to rub your hands palm to palm. Then you'll take your right palm on top of your left hand with your fingers interlaced and rub your fingers in between each other. Then you're going to interlace your fingers with your palms facing and move them back and forth to clean in between your fingers. Then grasping palm to palm, grasping your fingers together, you're going to clean the backs of your fingers by moving your hands back and forth. Then you're going to take and grasp your left thumb with your right hand and encircle your thumb with your hand on both hands. Then with your palm up, take your fingers and place them onto your palm and move them in a circular motion back and forth to clean your fingertips. And then once that's completed, and then once your hands are dry, then your hands are safe. Washing your hands consists of using soap and water to scrub for 40 to 60 seconds. To do a hand wash, you're going to wet your hands with water, apply enough soap to cover your hand surfaces, and then you're going to go through the same hand motions that you went through for the hand rub. Once all your hand surfaces are clean, then you'll rinse your hands off, dry them thoroughly with a single-use towel, then use the single-use towel to turn off the faucets. And now that your hands are dry and clean, they are safe. But when should you clean your hands? You should clean your hands when you're preparing for food, before, during, and after preparation of food. You should Wash your hands before you eat and after you eat. When you blow your nose, coughing and sneezing, you should wash your hands after. When caring for someone, you should wash them before you do any care activities and then after you do care activities. Touching animals, animal feed, and animal waste, you should always wash your hands after. Touching garbage, wash your hands after. And when using the toilet, wash your hands after. Perform hand hygiene before and after touching your face and nose. Respiratory hygiene can reduce the spread of germs that cause respiratory infections such as COVID-19. Things you can do: turn head away from others when coughing or sneezing. Cover nose and mouth with a tissue. Discard used tissues into the trash immediately. Cough or sneeze into your sleeve if no tissues are available. And the most important is to wash your hands. When should you use a mask? 1, when you are sick. 2, when you care for someone who is showing symptoms of COVID-19. And 3, when entering a healthcare setting that cares for or screens for COVID-19 patients. How to properly put on a mask. 1, before putting on a mask, wash your hands. 2, pick up your mask and inspect it for tears or holes. 3, figure out which side is the top. This should be the side with the metal strip. 4, make sure the correct side of the mask faces outwards. This should be the colored side, which is normally blue. Tip to remember, the blue side should be out with the blue sky. Number 5, bring the mask up to your face and pinch the metal strip so that the top of the mask forms to the shape of your nose. Place the elastic loops around your ears. 6, pull the bottom of the mask down to cover your mouth and chin. Once you've completed all these steps, you have now properly put on your mask. The advantages of face masks are they reduce the potential exposure of risk from infected people during the pre-symptomatic period, and they reduce the stigma of wearing masks in public. Risks of healthy people using masks. Self-contamination can result from touching and or reusing a contaminated mask. Depending on the type of mask worn, masks can cause breathing difficulties. A mask can create a false sense of security that leads to less adherence to preventative measures. Diversion of mask supplies can lead to a shortage of masks for healthcare workers. Use of gloves. The use of gloves does not prevent the need for cleaning your hands. Hand hygiene must be performed as needed regardless of glove use. Remove gloves to perform hand hygiene as needed. Discard gloves after each task. The use of masks and gloves are only effective if used throughout potential exposure periods. They are only effective if adherence is 100%. They must be properly used and maintained. The use of masks and gloves does not eliminate the need for hand hygiene. Other preventative measures are avoid touching eyes, nose, and mouth. Practice social distancing at least 1 meter or 3 feet apart. Telemedicine. These are telephone and or video calls with healthcare providers. Telemedicine reduces your exposure to healthcare settings where COVID-19 patients are or may have been. Physical barriers. These are glass or plastic windows that aid in social distancing and help prevent the spread of respiratory secretions. If you do contract COVID-19, symptoms include fever, cough, sneezing, headache, and difficulty breathing. Stay home. Seek early medical care. Share information about your recent travel and contact with the sick. So let's review preventative measures. Hand hygiene is the best way to prevent the spread of germs. Wearing gloves does not replace the need for proper hand hygiene. Respiratory hygiene, covering your mouth and nose when you cough and sneeze. Avoid touching eyes, nose, and mouth. Practice social distancing at least 1 meter or 3 feet apart. Use physical barriers when possible. Wear a mask only if you are sick, around others that are sick, or if you are in a healthcare setting. This information is recommended by the World Health Organization. Making sure to follow these recommended steps is a positive strategy to protecting yourself and your family. These are references that were used in the making of the presentation. I want to thank you for watching my presentation on the prevention of COVID-19. I hope you learned something and that it helps you protect yourself and your family.